Welcome, everyone. Glad to see such a large audience with us today. Good morning, good afternoon, good evening, wherever you are. And thanks a lot for coming today for this first webinar to discover the Pathogen Data Network. The agenda today will be first a general overview that I'll be giving as PDN Director, followed by a dive into the Pathogens Portal, which is really the central resource of the Pathogen Data Network that is hosted at the European Bioinformatics Institute. And this will be presented by Henning Hermjakob. Then we will have a presentation on the ecosystem of Pathogens Portal Nodes with a perspective from the Swedish node that will be given by Johan Rung from the University of Uppsala. We will then have our session of question and answers. So please feel free to just ask your questions during the various talks and also during the Q&A. Put them directly in the chat or just ask questions live. And then we will finish with some perspectives and next steps by Guy Cochrane from the European Bioinformatics Institute and also Deputy Director of PDN. The whole session is being recorded, so you will be able to have the recording as well as the slides at the end of the meetings in a few days. So my name is Aitana Neves. I'm the Associate Director of Clinical Bioinformatics at the SIB, the Swiss Institute of Bioinformatics, and I'm acting as the PDN Director as well. PDN is one of 3 bioinformatics resource centers for infectious diseases, which is an NIAID funded program, so a program funded by the National Institute of Allergy and Infectious Disease that wants to offer accessible platforms that integrate public health, pathogen, and other data. Currently, there are 3 BRCs awarded, the BV-BRC that focuses on bacteria and viruses, the BRC Analytics with a stronger focus on analytical workflows, and PDN, the Pathogen Data Network, which is a global consortium that aims to enable really a global ecosystem of linked data and tools to support research and also public health response to infectious diseases and outbreaks. So this is our mission, and we can basically subdivide our mission in 4 pillars. The first one is to really foster data discovery to enable this global perspective on infectious diseases through the integration and referencing of scattered data and resources within a single portal. So really a place to go to find data, to find resources that might be scattered all around the globe. Then to support efficient surveillance and outbreak response through also an innovation aspect. So we also developed innovative computational approaches on pathogens of interest, and we have a particular focus on wastewater surveillance. We also want to enable timely data sharing through the development of private data sharing environments that are hosted at the European Bioinformatics Institute, but that eventually where data is eventually released openly, as well as with a dedicated workstream on policy and ethics to really ensure that we are aligned with policies and ethical frameworks that support benefit sharing approaches, really as a mean to foster timely data sharing. And lastly, we also want to support training and capacity building to prepare the next generation workforce. So let me now give you this really slide overview of all of PDN. So you see here in the center the Pathogens Portal, which is the central place to go to really discover data. This is a URL, and you can see a screenshot. And the idea here is really to be able to discover integrated infectious disease-related data, but also resources that are related to infectious diseases. The central portal is then interfaced with an ecosystem of Pathogens Portal Nodes. And these nodes, importantly, are community-driven. They can be, for example, at the level of a country, but what is important is that they are really driven by local communities. They can even be deployed in the local language to serve their researchers and even their citizens. the idea is really to propose their discovery of local data and of local services that can support, for example, researchers for their data management, analysis, and data sharing tasks. And importantly, it should be interfaced with the central portal by exchanging some information, for example, data catalogs of data that might not be yet public or that are sensitive and cannot be public, but that can at least be discoverable on the central portal. And PDN will provide a reference software implementation to basically facilitate the rapid deployment of such portal nodes. And you can see here the URL to already access the source code. So there are currently 3 portal nodes that have been set up in Sweden, Norway, and Switzerland. But the good news is that there are many more nodes to come. PDN has a yearly call for pathogen portal nodes. And in the first call, we had 8 awardees from Kenya, Morocco, Philippines, Tanzania, Japan, Costa Rica, Mexico, and Chile. So it's really great to see all of these new countries joining and really aiming to also develop their own portal node. And importantly, too, we don't want these portal nodes to live in silos. So we have also created a community of practice that meets on a monthly basis to really discuss together on the implementations and basically on the features that we'd like to see, on challenges that we might be encountering, and to really discuss in general where to develop further those portal nodes. It's also a place where we can discuss a bit more about data hubs as well that basically are below the portal aspect that really just shows and presents the data. It's also a place where we can discuss more the data management and data processing aspects. And so this community of practice really aims to have professionals that are involved really in the implementation or in the management of such portals and hubs. So if you're interested, just drop me an email and then I can put you in touch and invite you to the community of practice meetings. And like this, you will also be informed of upcoming calls, etc. So this is actually just the tip of the iceberg, because to actually get data available on those knowledge bases, it takes actually a journey. Metadata standards are extremely important to ensure first that they are machine readable and to ensure that they are also aligned with international standards. So we have really activities around this for specific pathogens that we prioritize. Then the data, how does the data arrive on the actual data hub that sits below the portal? It can be submitted directly by individual labs, or it can be submitted by data hubs that sit either at the European Bioinformatics Institute. So this is those access control data hubs where it's possible to submit data that is kept private for some time before they are openly released. And it's also possible that data is submitted to the data archival through local capacity, through local data hubs. And there as well, we basically want to foster capacity building through the community of practice of portal nodes. And very importantly too, as mentioned, policy and ethics are essential too, and it's essential to be aligned with international data sharing policy that are being also negotiated these days. And so we also have a dedicated work stream on policy and ethics in PDN to really account for these important aspects. Innovation is also important, as mentioned, so we develop also computational analysis pipelines, in particular on 2 axes, large language models to query complex bioinformatics results. So here we're speaking of really being able to query with text very complex results and intermediary results also from bioinformatics pipelines. And the other aspect relates more to the wastewater surveillance use case, is to develop advanced metagenomics analysis pipeline to be able to classify also the reads that usually remain unclassified with standard methods. So in a large bucket of reads from the wastewater, many reads will end up as unknown with unknown classification. And here is the next step, to take those reads and try to really identify further what they might be. We will also have pre-computed data set for some pathogens, priority pathogens that are defined by PDN, among viruses, bacteria, fungi, and eukaryotes and parasites. Here, the idea is that these pipelines that will be identified will be integrated in the pathogen analysis system. And like this, when pathogen data is submitted to the data archive, for example, to the European Nucleotide Archive, if it fits the pathogen and data type, it will be processed within the pathogen analysis system. For example, it will undergo assembly or it will undergo variant calling. And then the results will then become also available through the Pathogens Portal. So it avoids that everyone in the world is redoing those same analysis, and basically those pre-computed data sets are also made available. So that was a very short overview. Just wanted to say that this is a global consortium, currently 12 institutions from 3 continents, mainly Europe, also North America and Africa, but we are onboarding partners from Central and South America, Africa and Asia through the Pathogen Portal Nodes call. And that's really the aim, that basically we need a global consortium to address those global challenges. And in the next talks, you will be hearing really about the Pathogens Portal and this ecosystem of portal nodes. But I just wanted to emphasize here that this is just sort of the tip of the iceberg, what might be most visible. But there are many more activities going on within the PDN consortium. Hope you enjoyed the next talks. And now I'm handing over to Henning Hermjakob, Head of Molecular Systems at the EBI and PDN co-PI, for a dive into the Pathogens Portal and also discover some development perspectives.
No, that's okay. Good. So to dive a bit into the central Pathogens Portal and what is there now and what we are planning to develop. So the Pathogens Portal is really aiming to be a central discovery portal based on metadata for a broad range of data types which are related to pathogens. And this comprises, to a large part, the data, metadata, which is made accessible through the diverse pathogen portal nodes, and to provide a central discovery point across all of these, but also to provide discovery of related EMBL-EBI resources or subsets thereof which are relevant for pathogen research, as well as third-party resources, again, or subsets thereof which are relevant for pathogens research, and of course to also integrate with NIAID's own discovery system so that we really have central discovery capability across both a broad range of data types and a broad range of resources. And this is meant to be based on a lightweight metadata format, focusing on data discovery. We don't want to encode and manage all metadata possible, but really the use case is discover what's relevant to you. And we also, as mentioned already, we want to integrate with the NIAID data discovery portal as much as possible. And clearly, different resources have different technical capabilities, they have different sizes, there's different data types, and to be able to discover data across a broad range of resources, but also to go into depth where it's useful, we have a three-tiered metadata indexing concept where the third tier is aiming at just resource level discovery. So basically, this is just a list of resources and their links, like this resource is relevant to pathogen research. Then the next level is coarse-grained metadata and attributes discovery on the record level so that we can discover a specific record from a given resource based on the metadata which is provided by the resource. And then in the first tier, we aim for deep indexing with detailed record level identifiers and metadata, where we also are aiming for cross-resource harmonization where possible. And this will initially focus on the sequence-oriented data hubs where we have the underlying infrastructure. But we also hope that over the time of the project, we will be able to migrate resources gradually from tier 3 to tier 2 and possibly to tier 1 to provide increasing granularity of the data that is discoverable. So what does this look in practice? This is a screenshot of the pathogens portal. And if you enter, for example, enteric virus, then you get a first view of all the records which are hit by this keyword. And the sidebar always shows you the facets which allow you to narrow quickly down, hopefully, onto the data type which is relevant to you. And if we now narrow down to data from the national data portals, this shows the integration in, so far, I would say, a preliminary use case with the national data portals where we already have the metadata exchange established. You will hear more about that from Johan a bit later. And then you see there is data from a national data portal matching this query. Then you get the more fine-grained view of what the data records are. And then, of course, the link to the data, in this case, in the SciLifeLab Swedish Pathogens Portal. And of course, there might be then more further linking out from there. In another example, if you look, for example, for Aedes, then again, you get the faceted fine-grained results across different data types. And this time zooming in on cohorts, I'd like to briefly show the cohort browser as an example of a very detailed specific component for a specific data type, where you then see more details about available cohorts, and again then can link to the original data. But here you see also more ways of interacting with the query and narrowing down the query across different facets. One aspect which we consider important in making data available is also, of course, credit and recognition. And of course, we show the full records, including submitter information where available. But very often it might be that not everybody who has been involved in creating a data set is also directly referenced in the data set for a variety of reasons. And so one thing we are enabling throughout as many data sets as possible is what we call ORCID claiming, where you can select a relevant data set which you have contributed to. And then with a few button clicks, ideally, you can claim this to your ORCID record so that this is integrated with your publications and other scientific artifacts. And in this way, we try to support making data count, making scientific efforts relevant efforts being more than just publications. So now we move on to sort of immediate short-term plans. We are planning a major restructuring of the pathogens portal based on the priority pathogen list, which has been recently compiled by Sarah Monson and colleagues, and which combines the priority lists from major public health agencies and aims to cover both priorities, but also a breadth of different pathogen types. So we have added to the virus heavy list explicitly fungi and parasites to also cover a broader range of priority pathogens. And this is the highest priority list, but then it has levels of priority so that we can structure this as a central entry point for specific communities which are interested in these. And of course, the idea is also to exercise capabilities of the consortium and be able to quickly promote a new pathogen to the top of the list where that is relevant in the public health interest. Also coming up soon is the integration of the Pathogens Portal Support Center, where we will leverage the capabilities of the EBI training website to provide additional documentation on how to use the Pathogens Portal, to provide, for example, training courses, access to help desk, etc., in a way that has been well UX tested and aims to support users as well as possible in handling, well, the portal itself and potentially the many relevant data types in there. I've already mentioned a couple of times, a key aim of the portal is breadth of scope. And so we are aiming to visualize that breadth and show at one glance through this visualization what are the available data types, and then you can zoom in further onto these in a hierarchical manner, and then also through a long press and any of these boxes launch the query for all the relevant data records of this data type to allow further zoom in. And in the medium-term future, we also aim to use this visualization to visualize impact. So this is an example from which is already existing for the EBI search, where we show in this rendering the number of data items for each data type, but then also we show use the same visualization to show the access to each of these data types on a logarithmic scale so that you see the differences, but you still don't get small data types drowned out by very heavily used ones like literature. And then we, of course, aim to develop more complex visualizations like this one, which was done for the West Nile virus, which associates the phylogeny with outbreak locations. And this is a third-party tool, Auspice, and we aim to both use third-party tools where they are suitable, as well as develop our own tools where necessary, potentially explicit, in particular across data types. And that is just a quick overview of the short and medium-term plans. Thank you.
Thank you, Henning. So now Johan will present the Swedish perspective on pathogen portal nodes.
Yeah. Yes, so I'm going to tell you about the system of portal nodes. And as you've heard already, the Pathogen Data Network is developing a number of different resources in the ecosystem for pathogen data sharing. And in this context, I'm going to tell you about the portal nodes. It's the pathogen portal nodes has essentially two main roles in this network. And one role is to be the specific interface towards the pathogen portal, to make discoverability of data through the pathogens portal available for the local community. And the pathogen portal nodes will be run and operated by a number of different communities, and there's a number of sites already up and running that fulfilling this type of functionality. The pathogen portal nodes also have the role of supporting data submissions to the relevant repositories through the pathogens portal and make that data available to the international community that way. So the nodes can be connected to local data hubs where the local data resides, but don't necessarily need to be so. These nodes are actually built as relatively lightweight web portals where the data is shared and can be contained inside the website in a lightweight manner without the necessity of having heavy infrastructure underneath it. So we are going to operate in the coming terms for the project. We are developing also a more major capability of actually having data inside these portals in themselves, but the main role will be to interface between the community and the pathogens portal, the central one. So in that sense, the portal nodes functions like a community hub for the local communities where they set up, be it the region or the national level, where the data and information and guidelines and services and whatever may be relevant for the community can be shared through these sites. And the good thing about this is that it's lightweight, so it's very easy for a new region or country to set these up. So this hub functions very much in the line, very much sort of close to research often, or maybe close to information interfacing to the data that comes from, say, for example, public health agencies, or in other way, data that should be made available through relatively rapidly to the community without the necessity of having to go through major repositories ahead, but in sort of the early stages. And this means that we envision that these nodes also can be a focal point in the outbreaks, that this is where information will be picked up and shared at an early stage and then spread through the network through the pathogens portal itself. So the way that we are doing this in the project is that we are providing reference software. So this is provided through an open source license. And new nodes that will be established can take this code and start developing their sites based on what the Pathogen Data Network provides, and also with some support from the developers in the teams here. And we envision that this is going to be a way for also the developers of the new nodes to interact around the common repository that you can see here. The development of this node software is actually set up so that it could also provide the guidelines and recommendations linked to the implementation of the software itself, so that this should be as easy and lightweight as possible for new nodes to operate and implement. And the way that we're moving forward is that we are providing a software roadmap that will support the local developers in actually moving this ahead. We do envision that as new countries or regions set up pathogen portal nodes, we believe that this will diverge quite a bit, probably, but that the adaptability of the software should be such that each region or country should be able to adapt these nodes to actually fit that specific community the best. We developed this to be able to share a common software component. You just heard Henning talk about visualization, for example, at the central portal. And some of the software developed at the central pathogens portal will be utilized in the node software as well, to be able to provide visualization or other kind of, for example, build up dashboards for local data, even when such local data is of a type that wouldn't be submitted necessarily to one of the main repositories, but even data that can be sort of continually stored from the lightweight capabilities of the portal nodes. There's a lot of freedom in this for the local communities to work with this software so that you can actually fork and develop in whatever way you would like to do. And this is the way that we have already started in the nodes that are up and running so far. We can see that they all have common themes, but are quite different in what they do. But in the common, through the Pathogen Data Network, we will be able to support the formation and alignment through such a network. And as Aitana already mentioned, through the community of practice, where we can share information and feedback on how to move forward with data sharing. So I wanted to just show you some examples of how this works, what you have in particular in this. One of the things that we can see in the nodes, and this is from the Swedish node, we are hosting wastewater surveillance dashboards. So here you can see a visualization of influenza virus levels in wastewaters through around 20 different collection sites in Sweden. And we would share this here, and actually through the portal in Sweden, this data, the raw data, is actually also shared directly as it comes through the research groups. So at least in Sweden, the quantification of virus levels in the wastewater done on the research level is actually conducted by a number of research groups. And they will provide both information about the methods openly and about the data types and about the annotation and about the standards they are using openly through the portals so that this can be adapted by others in the community. And this also means that through sharing this, as we, through the Pathogen Data Network, collect and share also wastewater surveillance data, this is something that can be collected from at an early stage on the local level. So we also have the discoverability of data coming through the central portal. So here's an example where we can see also again from the Swedish portal, where we're looking at accessible data in the Swedish, from Sweden, available through the central portal. So the main website in the background is the Swedish portal. We can look at all the different, here nearly 18,000 results from the sequence data resources at the central pathogens portal. And if you click on this result, you will go and extract that information and go further deep into the actual data records at the central pathogens portal. And as you can see here, you have a number of different types of data. And I saw in the chat there were questions about, for example, serology data and others. And the portals can actually deal with all types of data on the local level. And some of it, quite a lot of this, will have relevant repositories at the central pathogens portal that will be there it can go to. And I'm sure that question will be brought up later as well. Another example of how this works for the local community is that the portal actually also work with the type of data that is relevant but may not be of the scientific data type. For example, here are examples where we have, for example, lists of research projects that are, for example, here projects related to antibiotic resistance, and where we can list projects related to the funders and different topics, and where also this is very useful for example, funders to go in and see, to track their projects and to track the data that is delivered through their projects that are funded this way. Also maybe relevant events or other type of information that is useful for the community. We have, and here, this was the sort of examples from Sweden. We have a few examples also for how this relates to local public health data resources. And at the different resources that we have up and running now, the local portals from Norway and Switzerland and Sweden, all of us have in different ways accessibility to public health data resources, to the different agencies, to health data which may be accessible through other kind of data providers. So that means that the local portals provide information and data that is also broader than going to the central portal. it is really functioning as the sort of bidirectional link between the sort of broader community for pathogen data and the central data repositories. The way we're working forward, I was just going to tell you about, and that's now, as you heard, the Pathogen Data Network supports expanding this network of pathogen portal nodes. And this is done through the seed funding and through this sort of software implementation that we've done. And a number of countries already have been awarded. And now the next step for us is to start working with them and see these new nodes being established and start the community of interactions with these through the community practice, and where we also in particular will have connections with the developers and the data scientists in the different regions that set up these pathogen portal nodes, so that we can work in with this. So that means that the Pathogen Data Network will really function like a network, including the new nodes that will work and share data and work on data, the pathogen data. And in particular about this network is about the alignment of methods and of course fair data management and the software development through this one. So that's what I wanted to tell you about the pathogen portal nodes. Thank you.
Thank you very much, Johan, as well for your talk and your presentation. So we have already quite some questions from the chat, so we will go through them, and don't hesitate to also keep adding more questions in the chat. I will read the questions and I might direct them to some of you. So the first question from Greg Sempowski is the PDN restricted to sequence data, or can it also accommodate pathogen detection by serology and antigen testing? Henning, if you don't mind taking that question, because
I think Johan already briefly mentioned this, and the answer is yes, this is perfectly in scope, and we are aiming to have a broad range of data types, and for this, detection by serology or antigen testing is absolutely in scope, but it requires obviously that we have a partnership with a resource which provides this data. And we are definitely, and I think this question will come up again in across others, we are interested in building up these partnerships to extend the scope of the resource.
thanks, Henning. Next question from Adriana Erika Miele. Will it be linked to existing databases such as worm-based parasite? I don't know if you know that resource, Henning.
I think the answer is almost the same. Yes, but we need an engagement from the resource we are working with. We are not going to just harvest data, but of course, if, like you have just done, you announce interest in seeing this integrated into the pathogens portal, then definitely this is a point for us also to seek collaboration with in the case of worm-based parasite. Of course, one of the limiting factors is that there are funding constraints on all sides, and so we have to see how well this works in engaging, and also they would have to provide the necessary, they would have to invest work in providing the necessary metadata. But then definitely for us, if we get the metadata in a reasonable format, then adding a new resource is fairly straightforward. And of course, the better structured it is, the better the discoverability.
Thanks. The next question from Greg Sempowski as well. Does a node need to be a country or locality specific, or could it be a node for a consortium of researchers in multiple global sites? So currently, I mean, the way we have been working is that at least for the, in general, I would say, yes, the node can be a bit anything. It's, as we said, community-led. So it doesn't need to be really geographically sitting in one place. for the call of pathogen portal nodes, it's just slightly, different. It's just that then, it's also possible there to have a consortium. Then basically we have a subvention agreement with those awardees. And if the awardees are a consortium, then it's just about, maybe deciding who gets maybe the seed money, if maybe the partner that is more on the implementation side for the consortium or something like that. But yes, it's really community-led. Next question, Manan, I don't have the exact name. Are the data hubs hosted by PDN or outside parties? And PDN just provide links? In other words, how does one share new data sets? So maybe just to clarify, and perhaps then, Guy, you can discuss a bit more the core data hubs, perhaps. The idea of the portal nodes, because this question was asked during the talk from Johan, is the portal nodes are very light and they don't necessarily are a data hub per se. So the data might come from the ENA, for example, if you have data, or the GenBank, from the INSDC, or it might come also from your own data hub. I just pointed before to Guy because regarding data hubs, PDN provides the possibility to host data in private core data hubs that I mentioned in the introduction, which are hosted at the EBI. I don't know if, Guy, you want to say anything more to this, or?
Yeah, I can. Yeah, so the data hubs are a smaller part of this project, but they're a way in which, so they're a set of tools for people to manage sequence and other pathogen-related data, and to access compute and to begin to interpret those data. Often that's done in fairly public view, so it's done as part. There's a later question on INSDC, so that's done actually while the underlying data are already in INSDC through the data hubs. But there can be a period of confidentiality where people work on their interpretation prior to releasing things. When everyone else looks at this, though, of course, it comes through the portals. So the portals are very much the way of presenting the data that are available for researchers to access at any one time. There are the partners in the PDN project operate some of the broader data repositories and some of the databases, and the institutions involved in PDN are operating data services and databases in the life sciences that contain some of the data sets that one sees in the portal. And so there's sort of a direct connection with the people, but formally the submission of new data sets happens into repositories more or less outside the project, and then the portals and the portal nodes allow people to access those in a pathogen focused, infectious disease focused way.
Thanks. The next question from Jon Betke: is PDN restricted to human-related pathogens only, or are, for example, aquaculture-related pathogens also included? So indeed, you've seen a list of priority pathogens that was shown by Johan, but PDN is not restricted to those pathogens. It's just that for visualization purpose and for maybe some prototyping, these pathogens will be, let's say, the first go-to list. But however, the portal serves data that is tagged as pathogen, and it really aims to have this One Health component as well. So in principle, and again, correct me, Henning, Guy, any pathogen should get in, and certainly not just human pathogen.
I agree. Non-human pathogens are definitely within scope, but as hinted at earlier, knowing where there's interest through messages like this question or direct messages definitely helps in bringing it onto the radar and actually providing the infrastructure for it rather than just, it won't happen automatically. I don't think we are going to include everything that's tagged with pathogen because it's difficult to define the borders. And so knowing specific interest is definitely helpful. Also to know what to connect with.
Next question from Ayun Prasad. Will you require or facilitate submission to existing open data repositories such as INSDC? So again, I think this is a question that was related a bit to the maybe the data hubs or the portal nodes. So no, not necessarily. Again, the aim and the mission of PDN is to enable timely data sharing and ideally openly. I mean, it's really the mission of PDN to foster that. But we understand that sometimes data needs to be shared first privately. And this was also mentioned now by Guy. And there is these core data hubs that are hosted at the EBI that can give some time before the data eventually goes open. And if data is submitted first to the core data hub, then yes, it will be facilitated. Their open release is sort of part of what is offered. If data is hosted on local data hubs, the idea is to, at least as much as possible, share data catalogs. If data cannot be shared, can also sometimes be for good reasons like sensitivity of data. But otherwise, we would encourage open data sharing. But again, we are aware of different sensibilities on this topic, and that's also why we have this policy workstream that also looks into benefit access and benefit sharing as a mean to really find ways to foster as much as possible in the end open data sharing in light also of current international discussions, notably at the WHO. I don't know if anyone wants to add something to that question. Then we have Jonathan Eubank from Erinia. Regarding reporting projects and funding, is this being scrapped from pandemicpact.org or from primary sources? Johan, I guess this is a question to you.
Yes, so the one I showed for the funding information in Sweden, that was taken in a sort of database that was built for the portal based on Swedish data from the Swedish Research Council. So it was coming that way. And there are ways that we can, inside the software of the portal nodes, you can actually embed these type of lightweight ways of integrating data from almost any type of data sources that you can essentially code into that implementation.
Question from Davis Kuchaka. I am just curious that with multiple portals, are we not risking having redundant data, particularly sequences? Johan or Henning, if you want to answer that question.
I think the answer is yes, that is a risk. We are aware of it and we are trying to mitigate it as much as possible. Of course, unique identifiers help, and also that's why we are in communication with the resources. So, but it is a risk, and it's serious work to minimize that problem. Absolutely. But we don't have the one-size-fits-all solution for it.
So another question from Jonathan Eubank from Erinia regarding links. Are you connected to the bu.edu? That's the beacon project from so Biothreats Emergence Analysis and Communications Network. So not the other beacon. I'm personally not aware of it. We'll look more into that. Is any of you aware of it? Who wants to comment?
No, I looked it up.
Okay, so thanks, Jonathan. We will look more into it. The answer for now is clearly not. Jalal Nourlil, IP Maroc, what is the process for joining the portal the portal nodes. So I would say the first thing is really to drop me an email and like this to start joining the community of practice. And from there we can basically announce the calls for new pathogen portal nodes. And this is basically how this can happen. Of course, the code, the software, the reference software code is freely available openly. So you can also start even without funding, let's say from PDN. That's also, of course, possible. But I would say that the community of practice is definitely a good place to be if you're thinking of establishing such a portal node to really get in touch with others doing the same. Indresh Singh, how and what local node data is propagated to centralized pathogen data portal? Johan, you want to answer that?
I do that. So again, we say the local portals, they are portals and not data hubs, which means that they are essentially interfaces to the community, and it's a way for local researchers, for example, to help interface towards the end. So it means that depending on how you operate a local, you may operate it in a way so that you can support the submission of whatever data you have the competence and capability to do. But the portal itself doesn't store that data. So it's a way to sort of enable the link between the community and the main portal.
Greg Tsempowski so directs the CRADE network of EID researchers in 40 plus countries, funded also by the NIAID. We currently submit data to public repositories indexed by the NIAID data ecosystem. Does the PDN pull metadata from this index, or do we need to deposit the sequences into your repository? If you mean that you basically already submit the data to the INSDC, then that's enough, basically. Then PDN, actually, I mean, the portal actually pulls data from the INSDC. So if that's it, that's good. Otherwise, please get in touch with us just to make sure we can access and make all of the data discoverable. Another question from Sosh Manan. I'm really sorry for the names. Are the data hubs hosted by PDN? Oh no, sorry, that's the same question again, I think.
The question was phrased as a response to the original one. So it's the one from Aitana, which is the new one. That's why it shows up at the bottom.
Okay. How does PDN consortium align its data sharing policy with WHO guidance on responsible pathogen data stewardship, international biosecurity regulation?
I guess we have an expert for that. Guy?
Well, I'm not sure about being an expert, but yeah, so we've been quite closely tracking a number of things, in particular the INB negotiations and the treaty that came out a couple of weeks ago from Geneva, from WHO, and also the IPSN, the WHO Berlin hub, and their community of practice around this. So we are involved in building out a system that addresses issues that are of concern to WHO and WHO member states, including around attribution and provenance tracking and so on. And so we are building an open data sharing system. We hope in a way that respects the requirements of all the users, all the people that need to be users of the system, and we're trying to do that in a way that's very aligned with WHO.
And the last question we have is, can you please share the source code to getting started with PDN development? So I guess a portal node. I am from KCRI, Tanzania. Yes, I mean, Johan, maybe you can already paste in the chat the link to the GitHub. I also want to say here that you will find on our website the recording, but also the slides, and also answer to the questions that have been asked shortly. So in case you want to go back to everything that has been discussed, it will be possible. I don't know if there are any last live questions. Okay, so then Guy, if you want to give the closing words.
Yes, let me, I have a couple of slides I'll go through quickly. Okay, thank you. So I'll just briefly, I mean, as you heard the slides and the video we shared, I will just mention a few things in reiteration of what Henning and Johan told us about was coming soon. So additional data resources across the portals and portal nodes, further development of the data connectivity between the portal and the portal nodes and between nodes within the network. Development and release of the reference software for building out the portal nodes around the world, and solutions to build visualizations, dashboards, and so on to get more deeply into tracking and into the interpretation of the data that are available from the portals and portal nodes. And then the community of practice, so the group that meets to discuss the development and the requirements of portal nodes. And then there will be, in due course, a second call to help to engage new parties who wish to build portal nodes and connect into the network. So we've focused a lot on the portals and the portal nodes and the network that connects these together. That's a big focus of the PDN project. But as Aitana mentioned at the very beginning, there are many other components as well. We've been talking a little bit about the data hubs. The policy and ethics work was mentioned, some of the workflows. We work as well on standards, outreach and training, the various communities of practice. So there are lots of different parts of the project that you will hear about later. For the majority of people here, I think not from the consortium. And so if you're outside, there is an open community that we would encourage you to think about joining. And that is a community in which we aim to bring together experts in One Health, in public health, in infectious diseases, in microbiology, and so on, together with decision makers and policy makers, people who run the technical platforms, people who run the platforms that are connected and made available through the portals and the portal nodes, researchers, people in academic education, people working in funding organizations, and so on. So we really encourage people to join, a diversity of people to join the Open Community Forum. And there's a link here that takes you to a place where you can register for that. Just some things to look up for at any point in time. There are various things we're doing publicly and talking about the project, and here we have a taking a view across the BRCs, so with our other partner BRCs, and just what's happening over the next few months, well, over the summer, early part of the summer, in which our project and the other BRCs will be talking about various aspects and be available to discuss. There is a newsletter that tells you more about this. So if you want to track what we're doing and you don't want to miss any of these events, then the link on the left there will take you to a place where you can register for that newsletter. And so then I think, so thank you from me. It's been an interesting conversation, but I hand back to Aitana, I think, to close.
Well, just the same. Thanks a lot, everyone. It was great to see such a large audience. And as said, we really aim to be a global network. So get in touch with us if you have data types that you think are interesting. We're really glad to discuss further potential collaborations. Thank you very much again, and we'll keep you posted very soon with the recording slides and written Q&A. Thank you.